So on our the first antiviral drug we'll be discussing is the word acyclovir. All right, some people spell acyclovir with a I, some people spell it with a Y. Okay, but actually go with the Y on. Okay, because acyclovir. All right. So now we'll be talking about the pharmacology of this acyclovir, which is an antiviral drug. Okay, and every time we are discussing pharmacology lessons, it's good for you to actually pay attention to the mechanism of action, okay? Because for you to know how a drug actually works is power. It's basically knowing everything about that drug, okay? If you can know how a drug works, then you have known about the category of that drug, you have known about the types of that drug, and you have known about conditions where you shouldn't use that drug, okay? And that's quite more powerful. So looking at this acyclovir, this is how it comes like acyclovir starter cream. Okay, so we'll be talking about the mechanism of this drug and how these drugs helps to prevent, uh, if not really prevent, how it helps to what, how it is used to treat infections that are caused by what viruses. Okay, how does it attack the viruses? All right, what is its mode of action, which is the most important thing. So for the mechanism of action now, um, first of all, acyclovir is an what? A cyclic guanosine derivative. Okay. Um, if it goes into the cell, it will be phosphorylated by what? The viral thymidine kinase. Okay, to be phosphorylated, basically to be activated by the viral thymidine kinase, and also it will be acted upon by the what? The diphosphorylate and the triphosphorylates. Okay. Um, okay, it will be diphosphorylated and triphosphorylated by the host cellular enzymes. Okay. Now, its simple mode of action is by what? This is just a summary. We have the full mechanism of action here. So, for you to just simplify its mode of action, we just say that what it will to compete with the what? Deoxyguanosine triphosphate for viral DNA polymerase. Do you understand? So basically it is like deoxy, because it is what? An acyclic guanosine derivative. So it looks like a deoxyguanosine triphosphate. Do you understand? Because it is what? Triphosphorylated later on. Do you understand? So now the virus will feel like, okay, this is the normal deoxyguanosine triphosphate that I need for growth. So it's now take acyclovir in. Do you understand? So now this one now act in opposite to how deoxyguanosine triphosphate would have acted. All right, it will terminate the chain of that virus growth. Do you understand? So acyclovir phosphate, when it goes in, it will block the DNA polymerase, all right, and it will stop replication. It will stop the further growth and divisions of that virus. Do you understand? So now the full mechanism of action now, we said that acyclovir is a nucleoside analog that inhibits the replication of what? Herpes simplex viruses type 1 and type 2. That's the HSV1 and the HSV2, okay? And it also acts on what? The varicella zoster virus, that's a VZV. Okay, so now it is used to treat what? Herpes simplex virus infections, and it's also used to treat what? Varicella zoster virus infections. All right, including what? Infections like genital herpes simplex, neonatal herpes simplex labialis, that's a cold sores. All right, and it has an action on shingles, acute chickenpox in immunocompromised patients. That's basically patients that have an immune system that is not functioning optimally. Then it also has an effect on an action on what? The herpes simplex encephalitis. It has an action on muco- uh, acute mucocutaneous what? Herpes simplex virus infections in immunocompromised patients. and also herpes of the eye and herpes simplex what blepharitis. Okay, so this is how it looks like, acyclovir cream. And anytime you are seeing a cream, what would be the what would be the what route of drug administration? It will be topical. All right, cream, something that I can rub on the side that is affected. Okay, so what are the factors that can lead to its resistance? Okay, if there's an alteration in the viral thymidine kinase, because the viral thymidine kinase is what acts on it. You understand? So if there's a mutation and the viral thymidine kinase is no longer activating this acyclovir in the system, then even if you administer the drug, it will be what resisted. Okay. There's also alteration in viral DNA polymerase. Okay, if there's alteration in viral DNA polymerase, then it will lead toward its resistance. Okay, so a reminder on its mechanism of action again. After you apply the acyclovir, it is acted upon by the what viral thymidine kinase, phosphorylated. Then later on, it is diphosphorylated and triphosphorylated by the what cellular enzymes. Okay, then it will compete with the deoxyguanosine triphosphate. Okay, and it will inhibit DNA polymerase, thereby stopping replication. Okay, clinical uses, it has the topical formulas and it has intravenous ones too. It has the oral ones. Do you understand? So in here, I actually brought only the creams. All right. Perhaps is the creams that are kind of like much more common. All right. So it is cleared by glomerular filtration. That's if you basically apply through the intravenous or oral route. Okay. It will be cleared by glomerular filtration and tubular secretions. So uses again, it is used to treat what herpes simplex virus type of infection 1 and the 2. Okay. Then we have the varicella zoster virus. All right, it can be used to treat what infections by the varicella zoster virus. What are the side effects? Side effects include it could cause nausea. That's you'll be feeling like you want to vomit. Okay, it can cause diarrhea. It can cause headache. It can cause tremors. It can cause what delirium. Okay, so acyclovir once it comes through, it's acted upon by the viral thymidine kinase. All right, then next by the cellular enzymes. Okay, that means it will be what diphosphorylated and later on triphosphorylated. Then it will basically what inhibit the DNA polymerase. Okay, compete with deoxyguanosine triphosphate. All right, thereby stopping the chain. To terminate the chain. All right. What are the side effects of this drug again? We said that the common side effects include nausea, delirium, tremors, headaches, and diarrhea. Potentially serious side effects include what? Kidney problems and low platelets. That's what? Thrombocytopenia. All right, then pregnancy and feeding. Um, it is generally considered safe for use in pregnancy with no harm having been observed. All right, so it appears to be safe during breastfeeding. Right, so this drug is not contraindicated in pregnant women or lactating mothers. All right, that's it about what the pharmacology of this cyclovir, which is an antiviral drug. Okay, basically looked at the mechanism of action. We looked at the overview too, mechanism of resistance, clinical uses, side effects. All right, so that's it, guys, and bye for now.